in 1979. Seems like a long time ago. I am getting old, but so are you, Dick. When I look back at that, I wasn't the only missionary, nor were the other 6 expatriate doctors that went there the only missionary. There were 195 or 200 indigenous missionaries working in the mission hospital to which I was seconded. I'm not really going to talk about the recipients of the transcultural missionary. I want to address most of my remarks to those of us who go as transcultural missionaries. There are a third group when we talk about missions that we need to think about very clearly. These are the populations that we are sent to serve. And it's very important for us to have a clear perspective as we go as a transcultural missionary as to where we fit in this jigsaw puzzle of missionary work. Dick, in July next year, July 17th, will mark the 50th anniversary when I graduated as and I'm going to have to tell you my age, otherwise you'll think I'm much older than I am, as a young man of 21 from medical school. As I graduated, you don't need to clap for that. As I graduated, my classmates and I all thought that we had learned a tremendous amount. And now, as I come to the end of my career, I look back and realize that I probably knew very little. In fact, of the 50 years, I've spent over 35 years working either with or for the Seventh-day Adventist Church. I use the terminology with. That means that I was not being paid by them, but nevertheless working in an Adventist institution. But of all my years, the richest years, the ones which have blessed my life and my career the most, were those that I spent as a transcultural missionary, a missionary to Africa. So if you are thinking about mission service, it can be a most rewarding experience. But it can also be a very challenging experience. Going to Africa as I did in 1979 and having both a specialty qualification in pediatrics, a fellow of the Royal College of Physicians of Canada, and having taught at the Hospital for Sick Children and seen the likes of Johnny Jacobson and Wayne Jacobson come in there, and actually becoming the chief resident there at the hospital and taking over the suite that Joan Coggin had actually occupied at the Hospital for Sick Children. And then going on and studying obstetrics and gynae, and that was quite tough to go back and do another residency after you've been 3 years out as a specialist. I thought that perhaps I was God's gift to Africa. You see, when I went to Lesotho, there were no other gynecologists in the country. And I knew that 65% of the need of Africa had to do with maternal and child health. So perhaps I thought I was the cat's meow, you know. And when I got to the hospital there, I knew that I had a lot to teach them, because I could smell the latrines. I looked at the standard of nursing care, and I thought, I have been sent to teach them. This attitude was extremely unfortunate for them. But fortunately for me, I'm a quick learner. And I rapidly became aware that I had more to learn than they did from me. In the Sermon on the Mount, I guess I'm not clicking this thing as I should. So in the Sermon on the Mount, Jesus says, "Do not think that I am come to abolish the law and the prophets. I have not come to abolish them, but to fulfill them." In using the words "I am come," Jesus was just as easily could have said, "I am sent." In other words, his mission, he was come, he was sent. His mission was not to abolish the laws, but to fulfill them. Jesus said in other texts, he says, "My food is to do the will of him who sent me." In another place he says, "As long as it is day, I must do the work of him who sent me." The word mission is a work for which we have been sent. Mission could be thought of as our purpose here on earth. I used to argue in my younger days that our duty was not really to glorify God, because he didn't need our glorifying him, because he was far above our glory. I've come to realize that I need to glorify him to fulfill my purpose in life. And if I have a mission, that mission must be to glorify him. You see, God doesn't make us without a purpose. Every single one of us has a purpose. Whether you are in the dental school, the School of Public Health here at Loma Linda, in the School of Allied Health, a nurse working at the medical center here, whether you do office work, you have a purpose, and the mission in your work is to glorify God. And because we, all of us, believe that we have this mission, this university is unique, I believe, in the whole of North America. Loma Linda University realizes its mission is to make man whole, but in so doing is to give glory to God. Loma Linda University offers unparalleled opportunities to the student body to engage in international service. But Loma Linda University's prime purpose is to provide missionaries here on the continent that will represent to each and every person they interact with the glory of God. Mark Finley is writing out we are talking about blended mission and having a study group on that. And Mark came to the group and he had written so beautifully, "In a world grasping to get, Jesus invites us to give. In a world striving for supremacy, Jesus invites us to serve. In a world that loves power, Jesus invites us to reveal the power of love. It is his love that breaks hard hearts, opens closed minds, and heals sin-sick souls. And it is to this end that we serve as missionaries." Helen White writes there in Ministry of Healing that Jesus came as the unwearied servant of man's necessity. So often in mission we go about creating programs to be given in the cities, but they are our necessities we're serving. True necessity is a need that is not our own. Jesus said, "As the Father hath sent me, so send I you." Now, there are obstacles to mission. And in everything I say here, I want to say this in a most kindly way, and to assure you that if I talk about some of the problems, they have all been my personal problems. I have made more mistakes as a missionary than I would care to reveal to you today. But as I am talking, I want you to understand the difficulties that there are in being a missionary. If we are to serve, that's a little different from if we are to lead. Not always, but it can be. If we are to go to mission lands, it's very natural for us to feel that we are perhaps a little superior to those with whom we go to work. You know, people who are trained naturally feel that they have become better than people who are not trained. Otherwise, why would we take the training? You know, my ability to make a diagnosis, to perform some of the rudimentary surgeries that I saw listed there on the board, maybe to even predict a prognosis, may convince me that I'm a superior person. In fact, the very dependence and vulnerability of the patient may induce not only a sense of superiority, but sometimes a sense of entitlement. You know, this is the daily battle of the health professional. Every day, wherever you are as a health professional, we have to battle this sense of superiority. At the General Conference, I know that our blunt way of speaking as medical professionals, our way of speaking out, our way of feeling entitled to talk on this, that, and every other subject, sometimes can cause us to be looked at askance by some of our more gentle pastoral colleagues. It's not only our daily battle to remain humble. When you go to a situation such as Africa, as a fellow missionary said to me just a couple of weeks ago, Africa does that to people. It makes people feel superior. It makes us feel superior not only as individuals, it makes us feel superior as groups. If you go and search the web pages for global development, you will see that global development, terms like global motherhood, on the Poverty Matters blog, or wherever you may go on all of these kind of things, you will see that there is an inherent feeling in these types of web pages and blogs that the have-nots are going to benefit from the haves. In other words, there is the sense that we, us, Westerners, are coming to you, needy Southern Hemisphere people, and we're going to help you. It's not for nothing they make jokes about doctors thinking that they're related to God, you know. You see, the World Health Organization set up the Millennium Development Goals. They succeeded in many places with the Millennium Development Goals, but they also failed in many places. And sometimes they fail because of the recipients being unable to match what's being required of them. Sometimes they fail because there is a problem in the way we want to implement and initiate these things. You see, if we look at global statistics, and you've already seen some, 19,000 children under 5. This is not children total. These are 19,000 children under 5 dying daily. 800 women die during childbirth and pregnancy every day. And realize that these numbers are those because the Millennium Development Goals as relating to maternal and child health did not successfully reach their goals. Then you begin to realize the magnitude of the need. Over half the world, almost half the world, almost more than 3 billion people live on less than $2.50 a day. At least 80% of humanity lives on less than $10 a day. That is a sort of statistic that's calculated to make me feel, even working on a church salary in North America, that I'm actually very superior financially. The poorest 40% of the world's population accounts for 5% of the global income, and 22,000 children, that's when you start talking about those over 5, die each day due to poverty. 27 to 28% of all children in developing countries are estimated to be underweight or stunted. 72 million children of primary school age are not in school, and of those, they come from parents, there's 1 billion of whom are illiterate. Less than 1% of what the world spends on weaponry annually was needed to put those 72 million children in school, and yet that did not happen. You know, we've heard tremendous pressure on HIV, 32 million people living with HIV, but it's not even as big as the problem of poverty. There's 1.1 billion people have inadequate access to potable water. There's more than 600 million without sanitation who are living on less than $2 a day. There's 1.8 million children dying each year of diarrhea. And millions of women spend many hours each day collecting water. Every second child is living in poverty. 2.2 million children die each year because they're not immunized. 2.5 billion people rely on biomass, fuel, wood, charcoal, and animal dung. I used to watch the women in the villages taking the cow dung and making patties to put on the fire. And then, of course, I knew that they were going to probably bake bread, and I was always wondering, did they clean their fingernails? But you see, we are looking at a very serious situation in the world, and the list goes on and on and on. It induces donor fatigue. It induces boredom in many. And for those who would, like Jesus, become servants to man's necessity, it can be a powerful call. Yet, many in the developing world are skeptical of the usefulness and benefit of us as Western missionaries. Why? When we've got so much to offer, why would they be skeptical of us? How can it be that the very need which motivates us to serve can also create in us, even if we don't recognize this, a sense of superiority, and may I say it ever so kindly, even of arrogance? I've got to go keep my pages going here. I could just give it off this slide, I suppose, but I really want to try to keep a semblance of order here. Dwayne Elmer wrote a book, Cross-Cultural Servanthood. It was given to me. Cheryl Doss told me to get it. It's a wonderful book. I think that many of us should read that if we're going to be engaged. He asked this question. He said, what could missionaries do to more effectively minister to the gospel of Jesus Christ in other cultures? The answer that kept coming back time after time after time to that question, what could missionaries do to be more effectively minister the gospel of Christ in your culture, was they would do more if they didn't think they were so superior to us. Now, I'm showing you that need, a person's need, may actually make us feel superior. Let me give you a story. When I was about 12 years old, I first set foot in Africa. We went by boat, and the ship took 19 days to go from Southampton in England to Cape Town. All day long we heard the creaking of the ship as it went through the waves. The stairways would creak. There was the constant pounding of the propeller there in the background. And one morning about 4:30, 4 o'clock in the morning, the sound seemed to disappear. And I woke up not because it was noisy, but because it was quiet. And my dad also woke up and he said, come, let's go up. And he took me up on the deck. And I remember in the very early morning, 4:30, 5 o'clock, standing and seeing the lights of Cape Town. He pointed out to me Robben Island. He said, that's Robben Island over there. That's a prison, he said. We didn't know then that the iconic Nelson Mandela would be imprisoned on that same island. And then as the dawn came up, the sun came up on the eastern sky, it lit Table Mountain and all those mountains, began to shed its light across the bay. The motor, the engines of the boat were put up, and we nudged our way into the harbor. It was a great experience for a 12-year-old to look over the railings of the boat and watch how everything was done, when all of a sudden I started to see what appeared to be an invasion. Men began to clamber and climb over the ship like ants. It was to me a frightening spectacle. They were very ragged. Some of them looked dirty. And as they came over, they were laughing with loud, raucous laughter and shouting with voices in languages that I didn't understand. These were the stevedores coming to empty the boat, and I shrank back. That was my first contact with Africa. I shrank back in fear. And as I looked, I thought, these are a very different group of people. And I distinctly remember standing next to my dad and my mother and thinking, whew, how glad I am that I'm not like them. Dwayne Elder gives us a list. We are going as missionaries to serve. But you can't serve people you don't understand. And you can't understand others until you have learned about, learned from, and learned with them. You won't learn anything unless you've developed trust. You see, trust is important in the relationship. To build trust, others must know that you accept and value them as people. To accept others, you have to be open. Have to be open to other people. And then you'll be accepted. So, the implementation of any missionary endeavor begins not with us, not in medical school with the learning of our abilities, not even with the capacity to do the surgeries, which are so important. It's not in our skills that we begin, but it has to be in openness. And openness is the ability to welcome people into your company, to make them feel safe, secure, and welcome. It's be able to accept people and be open to their cultural heritage. And openness will be expressed in different ways in different places. Hence there is a book that's called Kiss, Bow, or Shake Hands, because we need to know how to express our openness. Openness is the essence of hospitality. It requires more than the usual 5 seconds we assign to evaluating whether another person is suitable for whatever we have in mind for them. Have you noticed that it only takes 5 seconds usually for us to evaluate whether we're going to like that person? Maybe we don't like the way they brush their hair. We don't like the thickness or the thinness of their lips, the set of their ears. Perhaps they stand a little tall and we think they're proud. Or perhaps they stand a little bowed and we think they're too humble. We do it in 5 seconds. Openness requires a suspension of that usual assessment process. a suspension of judgment, a tolerance of ambiguity when we don't know quite what to make of them or the situation. It requires a blurring of the black and white. Because when you get into a transcultural situation, things are not always as clear-cut as you might think they are. And it also requires what we call positive attribution, that you think the best of those you're coming to serve. Now, everything I'm talking about, of course, applies not only to us who are going as missionaries, but it applies to those who are receiving us as missionaries. And while we may gather here and talk like this and have the Institute of World Mission to try and train those who are going out as missionaries, unfortunately, we don't have such a program for the other missionaries who populate, let's say, our mission hospitals. And so they don't necessarily give these thoughtful processes to you when you go as a missionary. And it would be much better for the whole mission program if we could, each of us, have these kinds of attitudes. But seeing as we're not talking about them, but we're talking about us, let's apply the lessons to ourselves. Jesus was accused by the Pharisees. He was accused by the Pharisees of eating with sinners. Well, you know, I think Jesus enjoyed the food that they served. Jesus invited himself to the home of Zacchaeus, you remember? I think he enjoyed eating with sinners. So I don't think that there was a problem with Jesus when he ate with sinners. I remember listening to Gottfried Oosterwal many years ago at Andrews University, talking about openness and missionaries. He told the story of a very good health reforming missionary who went into Papua New Guinea. This is a village of Papua New Guinea. And when he went into the village, to the church, he preached to the members there, and a little widow woman invited him home for lunch. And she prepared for him the most delicious lunch that she could think of. What she had done was she had taken her hatchet and chopped off the head of her only chicken. She had plucked it of all its feathers. She had cleaned it lovingly and roasted it for him, and now offered him a roast chicken dinner for his meal. And as she served it to him with a look of anticipation on her face, thinking that this would be a delight to this missionary, giving her last chicken, the missionary said, "Well, I'm a vegetarian, sister." We laugh. We laugh. We have to be very careful. We have to be careful. If we're not open to visit with, to sit down with and eat with folk, we can fail in the very first step of building a relationship. It's uncomfortable. I remember a man who sailed on Mayflower 2. He'd been all his life a vegetarian, and he became dreadfully sick. He didn't think he could even eat the fish that they were catching off the side of the boat. We need to confront our problems when we're going to go as missionaries. Then acceptance. I want you to look at this picture. With whom would you identify yourself as a missionary? The one giving the apple, or the one receiving the apple? Because it's the one who receives the apple that is demonstrating acceptance. Acceptance is the opposite of rejection. It demands that we truly respect others and honor them and recognize their inherent dignity. It recognizes the importance of a person's language and tries to even learn a few words so that we can say "dumelandate" or a pila, huh? You at least must learn the basic introductions. It's very important for us to recognize that there may be differences in time. I hear us missionaries speak so demeaningly of local time. You know, we go for a meeting that's supposed to start at 1 o'clock and nobody arrives till 1:30. And we say, local time. We don't realize the cultural differences in the perspective of time. We look at time in a linear way. They look at time in a circular fashion. It just keeps coming round and round. No, it's a basic difference. It's a basic difference. And I think Jesus had that movement. Jesus said, sufficient unto the day is the evil thereof. So we get so tight and so narrow-minded and so upset because they're late. They're not late, it's just coming to meeting. With my British heritage, where I was taught to line up and to queue to wear a tie from the age of 4 years old, and a uniform, and to be one person, stand in rank and file. I get grossly insulted when I go to an airport gate and the mass of people are storming the gates because they're a culture. They don't exist as individuals. They are the group. And so they go through the doors as the group. And I have to learn to put myself with the group and go through the group, right? These are differences. Can I accept those differences? Am I going to accept those differences? Because until I learn to accept the differences, I am an alien. I am an alien in a mission setting. Dogmatism. In health ministry, we battle dogmatism. Dogmatism is not dogma. Dogmatism is the attitude we have. And it is a barrier to acceptance. Many of our missionary compounds are fortress mentalities. We've built them there with gates and walls. We have guards. Sometimes we even have guards with guns. There's a definite message that we're giving to the people. We're in control here. Oh yes, watch it. We have security here. I remember returning to my home and I don't know how they even got onto the compound. But when I came home after a day's work up at the hospital, I heard there was a party going on at my house. How had it happened? 25 women. I step inside the door and I looked around and the place was full of women, African women, and they were all laughing and and I looked around. It wasn't too hard to find my wife. She was the only white woman there. But I said, what's going on, sweetheart? She said, well, the village women, I invited them in. They wanted to know how to make cupcakes. Cupcakes? What do cupcakes have to do with mission? But here they were. Some of them were stirring the dough. Some of them were watching through the oven window to see the cakes rising. Some of them were tasting them, see if they were any good. My wife was whipping some kind of creamy mixture. Of course, we didn't have real cream there. We were mixing some dream whippy sort of stuff and putting it on the tops of these things and sticking in little wings so that the cupcakes actually had butterfly wings to fly. And as I looked at the group laughing and joking, I saw that in my wife's acceptance of these women, she had become accepted by them. I visited another mission compound in a backwater in South America, far in the forest. The villagers had welcomed the missionaries. Come, they said, we want the missionaries. They had, I must watch the time. Somebody just cut me off when I had my time. They opened the gates of the mission compound And the young missionary, a Loma Linda graduate young missionary, he opened the gate and he gave the kids a soccer ball. And the kids were able to play soccer on the mission compound. Flush with cash of about $150, he even ordered a feast for the village of rice and beans. And they all came to the mission compound. And they said to him, "We've never been invited into this compound." Even though the villagers had given the land, the missionaries had fenced it off. They had helped build the buildings, but the gates had kept them out. We must be very accepting if we're going to be good missionaries. You see, this isolation, this building of the barriers, this fortress mentality, these gates are meant to keep people out. Trust. Trust is that confidence that in another, that believes the other only will act in their best interests. As missionaries, this is a mindset that we must be able to cultivate. People must know that we are there. We need to have integrity. We must do away with the us and them mentality. Trust takes time. Trust requires time. Trust comes from understanding the other's perspective. Trust is strengthened through reliability. But always remember, trust is tenuous and easily lost. Then we have learning. I have a friend who's left the church. I won't identify him too closely because you might know him. He was a very able person. He worked with me as a missionary. He became a union treasurer in a country where he was the only paleface. He began to feel himself isolated. He thought that he was there only to teach. He did not see that there was much he could learn. And so he isolated himself from the group. And little by little, he withdrew into a shell of isolation. He purchased properties where on the weekend, instead of going with the saints on Sabbath worship, he went to nature, God's second book. And he spent his time communing in nature. The problem is, he didn't realize he had a lot to learn if he would have communed with the local people. Today, he is a managing director for a huge international company, but he no longer has connection with the church. We must be able to learn about, we must be able to learn from, and we must be able to learn with. See, I can learn about cell functions from a book, but if I want to understand how to do plumbing, I actually need somebody to show me how to do it. I'll never forget the man across the street who showed me how to do some simple plumbing in my house. I had some copper pipe that I wanted to put together, and I was trying to solder it. I was going about it all wrong. He said, stuff the pipe with some bread down both sides. Bread? Yeah, shove the bread down there and shove it down the other way, because that's going to keep the moisture out of your joint. Oh, what a neat trick. Then you don't try and heat the solder, he showed me, you heat the joint. And you touch the joint with the solder, and the solder will run into the joint when it's really hot. And if you don't have moisture there, steam blowing it out all the time, you just let it cool and then it's gone. And you turn on the tap, and the bread, with the presence now of the water, just goes out the end of the faucet. What a neat trick. I've soldered many, but I learned it not from a book. I learned it because he showed me how. So I was learning from. When we learn with, it is so helpful, because we now build the relationship. And we go as missionaries to learn with those local missionaries. It's possible for us to go to the mission lands with too much information. You know, I'm glad that you have gone into global health, Dr. Johnson. Because sometimes, as a neurosurgeon, you get to a mission setting, you just can't do what you know. Because you are too sophisticated for the local situation. I was on a plane the other day. Actually, Landless and myself, we were traveling on the plane, and the call went out, "Is there a doctor on the plane? We need a doctor." So Landless and I got up and we went to the front. You know, we do it with a sort of a strange feeling. What are we going to see? And when we got there was a young man who had preceded us. He said, "I'm a urology resident." So we said, well, I said, I did pediatrics and OB. He's a cardiologist. He said, "Great. If she needs catheterizing, call me." And he went back to his seat. Well, the two of us, we persisted to see what we could do. We wanted, you know, so we persisted a little bit, and it wasn't too bad. She'd had a baby. She was a little bit, probably stressed out, and the baby breastfeed, lactating, and so. And it was a minor thing. But Landless and I got bumped up to business class. So sometimes it pays to know, a little less, but a little more, if you know what I mean. The ward inside maybe a hospital like this, you look at that and that brings back memories of mission hospitals. The ward held 32 patients, all postpartum. We would bring them in from, all the surrounding clinics. And then we'd take them back the next week after they had their babies. So they waited usually 4 or 5 days. I thought it was a very good idea that I would go and give them a lecture. And so I got up and I had all kinds of little gadgets. I had diaphragms and condoms, and I had birth control pills, and I had IUDs. And I would stand before these 32 women with the very willing and accommodating nurse who translated for me. And we would do it all. And I did this week after week. And I said to her, what do you think they think about me giving these lectures? She said, well, Dr. Handysides, after you've given the lecture, they ask the cleaning ladies what they think about what you've been saying. And if the cleaning ladies agree, then they are apt to believe. And if the cleaning ladies say, he's just a white man trying to teach us stuff here, they don't believe it. So I instituted a new order of cleaners. They were the health aid cleaners who got a little badge. They had a class on birth control and contraception. They became partners, and we learned together. We learned and we taught together with. You see there, the trust that I had in my nurses to tell me the right thing led me to institute those people in whom the patients could trust, teaching them the right thing. Understanding. No matter how you think you understand, even after 50 years, I know there's more for me to learn. There's more for me to understand. And it's made doubly worse because the world keeps changing faster than I can keep up with it. So understanding is a difficult thing. No matter how eloquent a speaker might be, if he doesn't understand his audience, he's lost it before he even starts. Understanding leads to the recognition of patterns of behavior and a recognition of the values that give dignity to people. Stand back from the Renoir. If you come like this to look at the Renoir, you won't see much but a bunch of dots. Stand back from the Renoir and see the beauty. When you go as a missionary, stand back from the culture. View the whole thing. Get to understand the whole thing. You might learn that they are reticent to say no. So when you say, is this the way to Nokong? They will say yes, even though it may be the wrong way, because they don't want to say no especially when you're driving in that great big four-wheel drive Land Cruiser. You must know. If you say, is this the way to Nakong? They're going to say, yes. Understand the culture? Understand the culture. It involves far more than book knowledge. Most of you know the importance of clean water. I'm sure all of you, especially the public health people, could give all kinds of lectures on it. Do you know how dangerous it is if you're protecting a spring and you actually raise the level of the water at the base of the spring, that there's a back pressure on the spring? Did you know that? Because the spring may change its course and come out somewhere else, a kilometer further away from the village. Did you know that? There's so many things to learn, and I learned that when I was right there in the field. My village was called Nakong. I decided that it would be important for us, if we were going to really learn the culture, that we, each doctor, and there were 6 of us at the hospital, spend 1 month living in the village. And so when I got there, I at least had the facility of this great lumbering Toyota Land Cruiser taking me over the roads and crabbing its way down there. And I had a box of muti, that's medicine. And I went down this hill. And then they deposited me in the village. And the van then crawled back up the same way we'd gone. And I realized, here I am left alone now in the village. I was staying in the home of the pastor's father, who had 2 wives. I learned how 2 wives could accommodate the same man. It was very interesting. As I sat in the pit latrine, attending to nature's call, and could look out through the branches and the cracks, I watched village life, women with buckets of water on their head. The shouts and the talk of people walking around. I could see the proud rooster walking in the yard, and the women placing the peaches on the corrugated iron that they were going to dry them for the winter. At night, I slept in the typical African Basotho stone house with its thatched roof and the center pole, and just prayed that it wasn't going to get struck by lightning, because Lesotho is one of the most prevalent places for lightning to strike the houses. And as the things became quiet and village life died down, I heard the rustling of the myriads of insects in the thatch. I learned firsthand what it was like to be in the village. I was able to take a shovel and mix the mortar to prepare a special protection for the spring. Sure, in the evenings I was doing evangelistic meetings and speaking with them. And in the afternoons I was often treating them and giving them medicines. But I was just learning to serve. You can't serve those you don't understand. Underfunded hospitals, underserviced hospitals, inadequately equipped. We might be forgiven for thinking they are hopeless. I'm so glad that Loma Linda University doesn't think they're hopeless. That Loma Linda University has felt that there is more that you can do to help such hospitals. We can't think that these hospital populations will ever be able to feed themselves, living as they do on $10 a day in most of the surrounding areas. Now, could Loma Linda do better? Dick knows that I couldn't come to this opportunity without saying, could Loma Linda do better? I think Loma Linda can do even more. As I look back over the 50 years since I first set foot, well, it's now nearly 60 years since I first set foot in Africa, and the Africa today, I see a radical difference. And the difference is because of education. The difference, the change has come about because the people there have changed. They have become educated. And that's where Loma Linda has this great opportunity. Currently, AHI is educating in management, a very valuable and important initiative. But I would like to see Loma Linda expand its missionary endeavors with a overarching strategic plan that encompasses all that AHI does, but is even greater. And that there is no STT. No, I did not say STD. I said no STT, short-term trip planned, whose volunteers do not understand completely how they fit into the overarching strategy of Loma Linda University and the Medical Center. I would like to see such a strategy that includes not just the medical center and the medical people, but it includes everybody, as most of them do. But at the moment, there are about 2,000 odd students that go out from North America. With my propensity to tread as I do on thin ice, I sometimes ask the question, who gets the most benefit from this? The people they're supposed to be going to serve, or themselves? And I think most of us would say with honesty, we benefit more. And I think there's a need for us to say, can we change that paradigm? Can we perhaps make it so that those who are the hosts and hostesses of our visitations actually learn more from us? Just as we're doing in Malawi. I see you are in Malawi training surgeons. What a wonderful thing. Those surgeons will be there when Dick and I are throwing up daisies. They will still be operating. That's a wonderful thing. You must remember, as students need to remember, that it's the little foxes that spoil the vines. And sometimes we can do a great deal of damage when we don't have a clean mindset for mission. Sometimes it's the little foxes in the recipient places that spoil the vines. People who don't understand the overall picture and want to kill the goose that's laying the golden egg, because they don't realize they are partners with the missionaries. But we as transcultural missionaries need to establish that clearly by not what we say, but how we behave when we go to the mission. I could envision the university making special allowances for developing countries in some of the courses. I'd like to see us be innovative. I know Loma Linda may say, we can't offer that type of degree. But remember, we're consultants. Let their universities offer the degree, but let us support them in the development of the curriculum. I look at the new medical schools. Lima, Peru is opening up a medical school. We've just opened at Babcock. They're doing a fantastic job at Babcock. I'm so pleased that the representation from Babcock is here. Dr. Nkoro. We've got a new medical school possibly coming in the Philippines. There's the medical school down there in Argentina. Loma Linda has fantastic capacity to help. I would like to see visiting professors come teaching modules from Loma Linda and these new and fledgling universities. But it will have to be done with the sensitivity that I've discussed in this lecture, in this presentation. My heart beats proudly whenever I hear of Loma Linda doing something good. I read in the University of Maryland's School of Medicine bulletin that they are proudly opening a proton beam therapy, and they are going to be only the 12th in the nation to have such an instrument. And I thought, that's Loma Linda. That's the influence of Loma Linda who had the first. That's Dr. Slater. But I wouldn't detract from their pride in being the 12th. more power to them. I just smile and feel good and tell Al Reese, the Dean of the School of Medicine, how pleased I am that they are so progressive there. I don't have to sell him. You remember Loma Linda had it first. And so, in the context of your abilities, I'd like to see the School of Public Health think about adding to schools of nursing, the Bachelor of Nursing program, maybe an extra year in public health. We're sometimes not modeling the best model for Africa because they see us as doctors and nurses, they see the clinic setting. So they, as a nurse, they want to sit in the clinic and wait for the people to come and visit them so that they are little clinicians. If we added a year of public health in which we emphasized the need for this nurse sitting in the village to be actually involved in the sanitation and the digging of the pit latrines, and the procuring of safe water supplies, and the ensuring that the villagers were all getting their children vaccinated. If she had that extra year, and she got a degree, maybe we could call it BPH, not benign prostatic hypertrophy. That's a concern of old people. And not, as my secretary first typed it, benign prosthetic hypertrophy, which is the plastic surgeon's nightmare if he's put them in this big and they shrink. But, you know, what I would like to see is a Bachelor of Public Health. And I think you could get people to stay on for an extra year if they got a Bachelor of Public Health and a Bachelor of Nursing Science. That's the kind of thinking that I want to challenge the university with. And my time is up. It's been great being with you. I enjoyed it.
Thank you, Al. Appreciate your message always and deliver it in a compelling way. The rest of the morning we're in breakout sessions. There's 2 different sets of those. 2 of them are upstairs in the 2 amphitheaters upstairs, which is right up this direction, 2 floors up. And the other one is the Carroll Small Amphitheater, which is right across the hall from here, the next amphitheater next door. So take the time to enjoy each other and share. We do ask you to keep filling out your evaluation forms. Is there one for Walt's thing as well? Okay, but for Dr. Handysides, fill out the evaluation form, and then let's scatter to the various sessions. We'll end up together back again at 12:15 in the 4th floor where we were last night for lunch together and the tabletop discussions at that time. Thank you.